Okay, guys, this week was about decision making. This one's very exciting because I am a Libra, as most people would know, born October 19th. And one of the biggest issues for me would be decision making. So this week's reading was actually very important and actually very significant and very impactful for me because I do have a hard time making decisions. So I tried and I read the articles and I tried to apply it to my daily lives and, some of the biggest decisions ever. And one of the topics they spoke about was in the video they spoke about, which was kind of strange because I tried to apply it also, food. I work in a facility, a medical facility, a surgical facility with various departments. So a lot of things that we like to do is eat together, choose food and places, and how we're gonna eat. And that is a 20-minute pre-op. So we always like stop for 20 minutes. We send a group chat. And I'm ordering. What would you like? What would you guys like to eat, etc., etc. And so you could be very busy with your work, and all of a sudden, boom, somebody gives you a text with a group message. What are you guys ordering this week? We're doing this and this and this. So deciding what you want to eat within a period of time, even though I say 20 minutes, is usually about 5 to 6 minutes. And so the decision making stated making it a habit to eat certain food. Now, even though I've done this way before the article, which was very strange, I found that it's very reassuring that I'm doing the right thing because I always order one food, honestly, which is I'm the one guy that's like I'll have the same thing as before. I do like to explore different food, but I have one meal. No matter what the group choose, I choose one meal. Simple as that. If they say, "Hey guys, we ordering from, let's say, halal guys," I'll say, "Okay, I have the mixed platter automatically. I'll have extra protein. I have the salads on the side, sauce on the side, etc., etc." So decision making is making to a point where it becomes almost like a reflex. Automatically point A leads to point B. I do feel like it's a little bit kind of repetitive, and at the same time it's very safe. Um, I do like to get my different type of food. I do like trying different food, but in a situation where I had to make a decision as efficiently as fast as possible, because I'm a type of person that love to focus on my work. Like I will definitely be faced on the computer for about 10 hours straight, only to stop when they ask me a question. If a fellow colleague or one of my you know entry levels want to have more, they have more questions, or they'll need more details about a certain topic or a certain procedure, or the fee schedule, or even physical therapy and how to obtain those medical documents. I will stop for that. But when it comes to that decision of food, when it comes to more personalized, it seems like it's a little bit more difficult, which is what to discuss. I feel like if it's something that's more personal, it's harder for somebody to make a decision rather than something that's systematic. As far as work goes, if you tell me, hey, why does clinic not get paid? What is going on with this procedure? Will this procedure get paid? I would analyze that patient's insurance as fast as possible. One, two, three. And then I will see the medical records that we have, the doctor's notes, and I'll indicate whether we will be paid and how much we will be paid for that procedure instantly. That's just how it goes. But you ask me, hey, Chris, Ford, I'm about to order from this new place, and I'm gonna say, okay, what do you have in the order, in the menu? And I'm just gonna look at it like, So I'm learning how to make more better decisions, and I did practice that of making systematic. Find something that you associate with, so that you could make something that's as simple as lunch easy. First method they described was to make it a habit, a routine. Like I said before, I make that my routine. If I see chicken, lamb, extra protein, I'm going for it, no matter what, because I'm trying to gain more muscle weight. So I'm focusing more on proteins and eating in a certain diet. Second method to describe is if you use routinized predictable choices. Let's say somebody interrupts it and I'm not sure how to respond, then I would just like find a way to just align it with something that I already know, in short. Okay, and then there was the last one, which was which is how use a timer. So I want to time it as fast as possible. So I think these all just transition into one smooth action. You know, nobody really realizes it. It's just like I choose this automatically. I don't have to think about it. As far as satisfaction goes, I am not worried about satisfaction. I am more worried about just getting this decision made, because reality of it is I'm not gonna stress. I already know this have this properties of it, and this is what I want from it, and this is what I need. Therefore, I no longer worry about it because I have the things that I need. And there might be more desirable things, but I would not have to actually draw my attention or draw my focus away from any other you know, obligation priorities because of a simple lunch. And believe it or not, my friends and I back in college used to make a big deal about lunch. I would spend approximately 1 hour fighting with somebody because I don't want to eat certain kind of food. And this is who I was at one point. So I've managed to learn how to just eat objectively rather than subjectively. And applying that in on my decision. It's objective versus subjective, and just knowing what exactly you want. Simple as that, and how it value and different properties of it.